All right, it is 5 o'clock. That time we come together every single day to remind ourselves that we're going to get through this, and we're going to get through this together. Say it with me. We're going to get through this. We're going to get through this together. One last time. We're going to get through this. We're going to get through this together. Now, I know it looks a little bit different today, and that's because we are over at our Emergency Management Operations Center. This is the area where so much of the work that we do in response to battling COVID-19 and also the work we do responding to natural disasters and other challenges that we face. So much of it happens here. So this gives us an opportunity to show you a little bit of the insides of our response. And I want to start today by introducing the head of emergency management here in Kentucky, give him an opportunity to welcome you to the center. His name is Michael Dossett, and he has been doing a great job. Michael.
Thank you, Governor, and welcome to the State EOC. We christened the building in 2013. We have about 25,000 square feet under roof. We're currently at level 3 for this operation. We're under unified command. We have about 100 personnel working. If you have an opportunity to see some of the floor, they're spread out over a number of buildings so that we can social distance and do our work. We basically do consequence management. So for this event, we're in support of our Department of Public Health. Also co-located with us are our Tier 1 partners, the National Guard. They have the Joint Operations Center here called the JOC. We work in concert with all cabinets. Every cabinet in state government is represented on the floor, and we work shifts 7 days a week. And we assist in procurement for PPE. Obviously, that is a strong issue throughout the nation, certainly for our state. And we also do resource management. We're in support of all 120 counties. Thank you, Governor.
Michael has been an invaluable part of this team, as has all of his staff, in everything from securing PPE to coordinating our Kroger testing sites. We appreciate his work, and he is renowned across the country for his experience in running an emergency management center and in responding. We are very grateful. So we start every day by saying we're going to get through this and we're going to get through it together because every single day we remind ourselves of how we're going to get through it. And that's by following the 10 steps to defeating the coronavirus. We talk about it every day because it's got to become a part of our muscle memory. Even when we are able to be healthy at work, we have to remember that we start being healthy at home. Healthy at home is still the key in social distancing and reducing your contacts to making sure we defeat this virus. And it's going to become even more important as we have a gradual and slow phased reopening of our economy. When we do that, we increase the contacts that we have. So we've got to make sure that when we're not at work or we're not at the grocery store, we're not getting supplies that we need, we are otherwise at home. So healthy at work doesn't stop being healthy at home. Social distancing. And we're in a different building today. And so making sure that even while we're here, any meetings that we are doing as much telework as possible, but still maintaining that social distance is critical. Avoiding crowds and gatherings. We're going to talk a little bit about when we can ease that just a little, but a crowd is still going to be a dangerous thing until we are further along in defeating this virus. It's going to be something that, again, we need to continue to avoid. And even as we're able to phase back to work, remember, you don't need to have an in-person meeting because everybody has a telephone. Let's make sure we continue to think in this way. Knowing when to seek care. Kentuckians have done a great job at this. Let's just make sure that if you are sick for another reason and it's serious, you do get some help. We have seen some, maybe for fear of COVID-19 or for the better reason of wanting to make sure there's the bed available to that person suffering from the coronavirus that hasn't gone in when they're seriously ill. We need to make sure that you do. And now that we're starting to open up healthcare, we know we have the capacity to take what we're going to see. Make sure that you see your doctor if you need to. COVID19.ky.gov. It's been critically important for us to be healthy at home. It's also going to be the main source of information for being healthy at work. Wash your hands and surfaces. Now, if you've been just in your house for a period of time, and we're slowly going to be able to transition to other areas, it's going to be really important. Washing your hands, cleaning surfaces there. Applying for benefits. So we have gone from yesterday, we had gotten our unemployment claims from March down to 37,000 from over 100,000. They're now down to 29,000 just in the course of today. I know that we have helped an additional 8,000. These are the ones left that either have identity verification issues or some other real issues too, but this is where the focus is going to be this week. But also make sure you sign up for Medicaid. Really important for the providers that are helping you out, whether it's with the coronavirus or anything else. Prioritize your mental health, do not travel, and report non-compliance. So we always have the 10 steps, plus one more that is absolutely critical. Fill out your census. This is going to be absolutely critical to our rebuilding. It's how many federal dollars come into Kentucky, and the federal dollars are just based on our population filling out a very basic survey. For every single one of you that fills out this survey, the state will get dollars we can use to help people out. You've been so generous. You have sacrificed so much. It's that same generosity and sacrifice that I hope leads you to fill out the census, and we are so close to being in the top 10. I would like to make that happen, and once we're in the top 10, let's aim even a little bit higher. And then I just want to mention something that I mentioned a book yesterday that some fourth grade class had sent in. I do want to thank during these times now the thousands of letters that we've gotten from people across Kentucky talking about their situation, but encouraging us to make the right decisions and understanding that we are all in this together. And the sacrifices that we make help other people. So I got a letter from Harper, and Harper wrote me a letter to me personally. And I want to read the letter, but then I want to talk about what she did. So Harper says, "Thank you for all that you've done for us. It must be hard with some people complaining." That's part of the job, Harper. "Thank you for trying and working your hardest. I'm happy with whatever you want all of us to do because I'm on your side." And I like that. But this is a copy of her allowance. She sent $1 to the Team Kentucky Fund to help other people. Think about that. That's truly special, and seeing that type of response out of our kids absolutely shows me that we can not only beat this virus, but we can come out better people, stronger people on the other side, which is going to help us with everything from the economy to how we treat one another. Today, we're going to learn a little new sign language, but first, something that I missed yesterday. For the first time, I missed social media yesterday, and I didn't believe it when my staff told me afterwards, and they checked the tape, and they were right. And every day we try to show this because all of us trying to do the right thing, even when it's not mandatory, is how we make sure that we set the right example, we get other people to follow. And remember how successful we are in addressing this virus, how successful we are at being healthy at work, whether we can continue to do that, whether we have to pull back, is all dependent on how many of us follow the guidance. Now, when just a couple folks can mess things up for everybody else, we want to make sure we are recognizing those doing it right. So here are our hashtags: Team Kentucky, Together KY, Patriot, and Healthy at Home. And we're going to also start Healthy at Work, especially as we move in to those phases. So here's a little bit of what we have seen that should have been shown yesterday, but the good work out there that people are doing. All right, so I'd mentioned all of LaRue County's first responders have now for, I believe, almost a month been wearing their green Team Kentucky shirts. These are folks that are on our front lines doing good work, and just seeing them every day taking so much pride, not just in what they do, but in what you do too, and being grateful but encouraging of making sure that you are healthy at home and that we are resilient enough to continue to do what it takes to defeat this virus. Remember, their safety relies on it. All right, this is Taylor, of course, working on non-traditional instruction and keeping busy in different ways in her home. Listen, kids are going through a tough time too, and we need to make sure we're there for them. But I know parents are also adjusting to a very new normal while our kids aren't in school. We now have a study out, but we know that the sacrifice that we're making, both our kids are making and our parents are making, is working. So we got to keep it up. All right, this is again our healthcare heroes. We can't recognize them enough, and every time you see them in all this PPE, you know how this virus is real. It can spread. This is why we worked so hard and in fact spent so much on securing PPE, and also why we're being so careful in a phased reopening of healthcare and ultimately of the economy. We've got to do this right. I believe we can do it right. It'll just take us being flexible as we go and always checking to make sure that our decisions are having the right results. All right, this again is schools being able and staff being able to come together, even though they're not physically together, to communicate with technology is very important, to feel a little bit of community. It helps not only in getting our work done, it helps with our mental health too. All right, I believe this is Wilshire Pantry, and they're preparing meals for first responders. We've seen this all over Kentucky. People that have facilities that probably aren't doing what they would normally do, are going through a tough time, are worried about their finances, but they still come in and use their resources to help other people. That's pretty special in a time of difficulty. And here's the Frankfort Police Department. When I was Attorney General, we got to work directly with them. An absolutely great professional group, lighting their headquarters up green every single night to recognize those we've lost, to show compassion, and to remind, in this instance, the people of Frankfort that they are not alone. And then I've loved seeing this too. You know, some can't get a green light that's out there, but they still want to show their compassion. And we've seen all types of different ways that people have been a part, even if they don't have that regular opportunity. Let's keep doing it. You know, even when we're able to get closer to a new normal, we're still going to have those out there that need our help and need our compassion. All right. So we've talked a little bit, and this is going to lead into the sign language we want to learn today. And we've talked a little bit about our test of humanity not being over. We talked about the test really having three parts. The first is sacrifice, and we learned that before. The second is patience and planning. That's really where we are right now. And the third is perseverance. Remember, it's everything we've sacrificed, pausing the economy, doing what it takes. Right now, planning and patience. We're going to lay out a plan here today. And perseverance, making sure we get it done, making sure that until there is a vaccine, we do what it takes to get it done. So today, Virginia is going to teach us planning and patience. Planning and patience. Okay, one last time. Planning and patience. Thank you. All right, let's start our update today with testing. Testing has gone well today in all 4 of our drive-through locations we do with Kroger. Those are the direct updates I get each day. They're not closed yet, but Louisville had over 264 tested, Lexington over 242, Bowling Green over 200, and Owensboro over 241. We got to make sure that in all these locations that we get all of these tests filled. We're going Tuesday through Thursday in Owensboro. We're going through Friday in Bowling Green. We're going through Friday in Louisville and in Lexington. Our sites next week with Kroger is we're doing a second week for Louisville and Lexington and Bowling Green, and our new site is in Ashland. So Ashland will start Tuesday of next week. You can start signing up for these slots right now. The portals are open. We want to make sure that you have an opportunity to sign up. It is open to the entire public. Now, increasing our testing requires that not only we get people signed up, but you show up. And I want to thank all of our leaders in Warren County. They've seen at least a portion that has signed up, not showing up, and they're doing a lot to push out in their community, wanting to take advantage of each and every test, and we appreciate that. Lexington is actually monitoring it during the day and then able to push some additional people there at the end of the day. That was their innovation, and we appreciate that. So, again, these are going to be our 4 Kroger sites next week. And remember, when you look at Ashland especially, it is regional. If you are in any of the counties around it, if you are in close driving distance, get online, sign up. We want to make sure that if you need a test, we can get you tested. Now, this is just part of all the testing that's going on all around the state. We have more testing locations than ever before, and we believe we're going to have new testing locations coming online as soon as early next week. Many of these now we're working with local health departments or others where we can provide the testing and they can provide the people. These are all drive-through testing. I know that hazards testing has gone up. Their capacity has gone up. They've had over 100 and I think they've had over 130 the last 2 days. They can accommodate more. So if you're in that area, make sure you sign up. Murray, the Callaway County Hospital, is doing tests, and they and Christian County, of course, have been doing it for a while. They have additional capacity still. And we added a couple yesterday, I think in Oldham County and in Maysville. So let's make sure that we get people signed up. All right. So our big news today that we're gonna talk about is Healthy at Work and giving some more information out. We got to start Healthy at Work with talking about the 10 rules of being healthy at work. Those 10 rules, which you'll see in just a second, are rules that apply to everybody. And they're different, and they're supposed to be different. They're not the normal rules that you would operate a business under because we're trying to operate it in the midst of a worldwide health pandemic. So remember, for any business in any phase, continue telework where possible. If telework has worked for somebody and they still are productive, don't bring somebody in just for them to be in. Phased return to work. We see this in the plans of major manufacturers like Toyota and Ford. It ought to apply to everybody else. Remember that you're probably not going to see the same amount of customers if you're a forward-facing business when you have an opportunity to open up. So let's make sure that we're phasing appropriately, which will better enable you to meet the CDC guidelines. On-site temperature and health checks. I know this is going to be new, and to some it may be difficult, but it is the way that we ensure that a workplace is safe and that we ensure somebody who may be infectious at that time and that we can detect doesn't ultimately infect others at the work, so you protect your workforce, but also any customers or any that interact with you. Universal masks. This is employees. If you're working inside at a facility, Dr. Stack talked about this. This is how we do this. It's different, but this is how we do this, and we reduce the spread, even though your contacts are going to go from 3, 4 to many more. And certain other industries are going to require other PPE depending on what they handle, how close they are to each other. We're going to be coming out with that guidance. Closed common areas, right? We can't do all the things to spread people out and then have a break room where everybody comes together. We got to think through each of those pieces. Enforcing social distancing. This means that any business needs to have staff, management, walking around, ensuring social distancing is being followed. It's not going to be an excuse, and it can't be an excuse to say, well, we told people what they should do, but they didn't do it. Limit face-to-face meetings, sanitizer hand wash stations, special accommodations. This one's important. This is about many different folks. It's about those that may not be able to find child care, but it's also about folks that are the most vulnerable, over 60, with heart, lung, or kidney disease. We need everybody to be really thoughtful and make special accommodations for those that are most vulnerable. Bringing somebody back who could be very vulnerable, when you have a phased-in plan, now you need to make sure that you're taking care of those folks. And finally, you need a testing plan, and we're working on having the connections where businesses know where they can send someone to immediately get tested. This is important because if we're going to be able to do this, even with an increased number of contacts, we got to be able to test anybody who shows up and has a temperature, and then we got to be able to contact trace throughout that business. So this is a piece that's going to be really a partnership between local health departments and the state and business to make sure we can do it and do it right. All right, so today we're going to lay out in very general terms a phased approach in May about when some things can start, provided that they can meet these top 10 rules and industry-specific requirements that we're going to work with those industries on, and they're going to have in advance. Those conversations have been going on, and this isn't onerous. It's just what's required to deal with the coronavirus. And our industries and associations have been very positive about wanting to work together and about wanting it to be safe. So let's start going through it. It starts on May 11th. And what we're going to do is every 10 days or so, we're going to be able to add some other areas. The first is manufacturing. Obviously, we have had a lot of essential manufacturing that's out there. This will allow non-essential manufacturing to come back if they have the appropriate PPE, if they do the temperature checks, if they do it in a phased, gradual approach, and if they continue to allow telework for areas that can do it. Second piece is construction. Now, a lot of construction has been essential too, but this will open up construction and also set some uniform rules throughout to make sure people are being protected. The next is vehicle or vessel dealerships, so auto and boat, and we're working on the last pieces of that direct guidance. There's been a lot of good plans there, and for example, in just how things will change, test drives, you'd be by yourself. If you're going and trying to purchase a car, limited numbers of people inside the dealership, and the whole process from which you say I'll buy it, and everything else that goes on from credit to all the rest. It's a process is going to be very different, very very different moving forward. Professional services. Now, a lot of professional services have been able to operate remotely, and to the extent you still can, you should. But again, this is a gradual phase-in where they'll be able to return 50% of staff. Now remember, that shouldn't just be 1 in every 2 people. If you've got an area that telework works, if you can do 30% and operate at your top capacity, you ought to. Because remember, if you have people coming in just to come in and the coronavirus spreads and we do contact tracing, it may send multiple people into self-quarantine. So you got to do this smart, not just on our end, but on the end of others. All right, horse racing. We were able to come to an agreement yesterday specifically with the group that's going to start, Churchill Downs. They're going to start accepting horses and start accepting folks in their backside on the backside of the track on May 11th. There will be no fans for racing, and I will tell you that this is one of the most detailed plans that we have seen about specific security checks that everybody has to go through and be temperature checked, to masking, to having a very limited group that is there. Finally, dog grooming, boarding. This should be pet grooming or boarding, but I'm a dog guy, so apparently it came up there. Also, a plan that was submitted to us that'll be part of the requirements where there is no person-to-person contact in how this is done. So this will be May the 11th. And one of the main reasons that we were able to do some of these is we've been able to work with a couple of these industries in the midst of this virus, with many parts of manufacturing being essential and construction being essential. And it's given us the experience where we believe we have the right guidelines to do it safely. Others are very low contact and or have provided plans that we knew that we could work with. So this is May the 11th. Let's go to the next one. All right, May the 20th. We have both retail. This is many of our forward-facing businesses that will be able to open in a reduced capacity, along with our houses of worship, where they will be able to do in-person services again at a reduced capacity. We're working on that. It's likely to be a percentage of the occupancy that is allowed. All of this is contingent on being able to keep social distancing, on the type of cleaning that needs to occur. And what our hope is that on the 20th, what it'll allow is just the worship service itself. And then we're going to be working with faith leaders. We've already been talking with them and encouraging, but working with them to see a gradual schedule where we can go from the one experience to some of the other pieces that typically happen, like Sunday school, for instance. But that right now would create very different contacts. And so let's start here, and then let's have a good dialogue where we can work with those that run our houses of worship to get a plan to be able to do more as we go. And after that, we have May 25th. And provided the virus is where we think it will be at that stage, we're going to be able to do some more things. First, we believe by May 25th, using social distancing, masking where necessary, that we'll be able to allow 10-person or less social gatherings. I know we've all been cooped up, and you want to see, at least if you're us, one other couple and their kids. This is an opportunity to potentially get there. We want you to know that we think this is possible, but it's all contingent on all of us doing this right, on making sure that we don't see a spike in the virus. But there is at least a light, I hope you see at the end of the tunnel, where we can get together a little more. And then barbers, salons, cosmetology businesses, and similar services we see on the 25th. Now, I know that there are some things that aren't included up there. And just because you're not included up there, it might just be that with all the different industries and associations, we haven't listed you. But a couple things that aren't going to be in Phase 1 that we want to work directly with associations and industries to talk about. Number one is restaurants. This is hard on two ends. Number one, in seeing how the virus spreads, and it's hard to have a mask on when you eat. But number two, I know it's hard on the restaurant end if it was based on really limited capacity with the margins that they have to make that work. I know that might not be for everybody, but we want to work with you in the industry to try to figure out how to do this and how to do it safely. And I know we only want to do it if we have a safe experience. Another that we want to be in Phase 2 is gyms. Later, but not in Phase 1, movie theaters, campgrounds, youth sports. We hope in this summer, and we don't know if it would be June or perhaps early July, we hope that we will be able to do some youth sports. Again, it depends on how the virus reacts to changing temperatures and the rest. It can't be in phase 1, but we do have hope. Public pools are not in phase 1 and won't be in phase 2. The ability, even when we're able to expand groups that can get together in the size, a public pool will never be able to contain that to the size we need. I know people look forward to it. I know it's important in the summer, but that's going to spread the coronavirus, and it would prevent us from doing all of this. Summer camps. Unless we see something different in the data, certainly not in phase 1, it's going to be really hard to have it in phase 2. It would be nice to have summer camps, but the way it increases contacts, and we're going to show you a visual tomorrow, we couldn't do this reopening if we had it. And the last one's really hard. We're not going to be able to do daycare in phase 1. That's hard, and I know it's hard. But here's the best example I have for you. We're going to show you graphically tomorrow. Right now, if I'm at home with my family and I'm healthy at home, there's 4 of us. So I've got 4 contacts if I include myself. If I go to work and I work with 10 other people that have the same number of contacts, I go from 4 to potentially 44. I hope, following these guidance that we cut that down. But if one of my kids goes to a daycare with 30 other kids, each of which is having at least one parent going to work and having 44 more contacts, we get all of that back. So we go from a controlled amount of contacts to almost an exponential growth. Now, I know this is hard, but if we allowed it right now, we couldn't even do this. So we're going to have to look for solutions. We're going to have to work at hopefully a June solution to that. But I want to be transparent. I know it's going to make even this difficult, but if we did it right now, we couldn't do this. So I hope people will stick with us and work with us. See this as a way forward. See this as truly being able to see steps being taken, which they are. But I hope everybody also sees that these are cautious steps that are going to be done with strict compliance. And I would not be suggesting these if I did not think that we could not do them safely. And if it proves that we can't do any of them safely, it is always subject to pause. We cannot allow ourselves to have that second spike that we see in the Philadelphia versus St. Louis. I'm not going to let us have that spike, and when we see it coming, we'll do what we have to adjust, and I know that everybody is with us on that. So just a little bit of an outline on where we're going. Again, there's going to need to be a lot more detail. I'll give you a little example of timing here. For the May 11th groups, I will have the final, from our end, recommended requirements tomorrow. We're going to turn them around and get them to associations. The Chamber's been working really well with us on this and others to comment on, and we hope to have them final this coming Monday, so everybody will have a week to get ready. And all of this allows people to get ready, because if you can't get the masks or the other PPE you need, if you can't get the sanitizer or the hand washing stations, you can't open. Again, we can't, regardless of the reason, not have an unsafe environment simply because it's difficult to get what's necessary. I know we're working on providing, or on trying to create, the private sector is trying to create a supply chain for sanitizer. Our distillers have done a good job. They got a lot more sanitizer they can get out there. And then, remember, we showed you the video yesterday of how you can make a mask. So let's make sure that we get those things done. And if you're excited about this and you're ready, or if you're a little nervous, these masks are going to become more and more important. It's one of the ways that we can stop a spike, even having more contacts. And it's a way, if you think we're moving too fast, that you can make sure you're protecting yourself and everybody else is too. All right, let's move into our numbers for today, and I want to reserve enough time for questions since we've outlined that. Today, we are reporting 184 new cases of the coronavirus. That is, again, right around where we believe the plateau is, up one day, down another. Some are still trickling in that would have been reported over the weekend or Monday. But again, we are not seeing an escalation day over day. which means we are either at the top on the plateau or we could potentially be declining. We won't know that until we are into it. Total number tested, 54,101. Ever hospitalized, 1,359. Currently, 325 Kentuckians. Ever in the ICU, 636. Currently, 176. That's up. Let's make sure we're thinking about those people. And those that have recovered, 1,668, also up, and we're glad to see that. New cases by county, 60 in Jefferson, 50 in Warren. That's why we're there this week, and it's why we're going to be there next week as well. Davis, 16, Kenton, 6, Fayette, 4, Allen, Campbell, Graves, Jessamine, Muhlenberg, and Simpson, 3 apiece, 2 in Butler, Edmondson, Grayson, and Wayne, and 1 in Adair, Anderson, Barron, Boone, Breckenridge, Clark, Estill, Floyd, Hart, Henderson, Laurel, McCracken, McLean, Monroe, Oldham, Spencer, Trigg, and Woodford, and we are still tracking down 4 of those cases. And we've had a tougher day in terms of deaths. We'd had a couple days where it was lower and a lot lower than we'd seen. But today we have lost 10 people, 10 new individuals, 10 Kentuckians that were loved by their families and their communities to this coronavirus. 10's a number we don't like to see. This continues to especially take those that are most vulnerable from us. It continues especially in the senior living facilities to be as deadly as we were told that this virus could be. Those that we have lost, again, are more than an age and a gender and a county. I mean, that's the information we have. 58-year-old male from Jefferson, 56-year-old male from Warren, 94-year-old male from Jefferson, 96-year-old male from Grayson, 94-year-old male from Jackson, 72-year-old male from Jefferson, 94-year-old female from Hopkins, an 84-year-old male from Jefferson, a 66-year-old female from Jefferson, and a 101-year-old female from Grayson. In all of these instances, people that would have still been with us, at least we believe that, but for this virus, let's make sure that we light our homes and our institutions up green tonight to remember these 10 new Kentuckians we've lost and everybody else that we've lost along the way. So after making the adjustments and audits that we do every day, our total number of cases officially is 4,539, and that includes lab confirmed 4,538 and 1 probable case. And total deaths 235. That's lab confirmed 234 and 1 probable case. We're breaking it out to be fully transparent in what those numbers are. Race and ethnicity information. Total cases, race 74.62% white, 13.67% black or African American, 6.68% Asian, 4.88% multiracial. Ethnicity is about 91% non-Hispanic and 9% Hispanic. On deaths, 78.92% white, 18.13% African American, 1.96% Asian, 1% multiracial, and then on deaths, it's 91.5% non-Hispanic and 1.5% Hispanic. Now, there are days where we get to talk about individuals that we've lost, where they're not just a name and a county, where they're not just a county and an age, but we actually get to provide a name. Admittedly, yesterday's was a little emotional to me, so thank you for bearing with me on that. But the way I felt yesterday is the way that countless people feel about each and every one of the individuals that have been lost. So let's make sure that we do everything for them at a time where it is harder to go through this probably than ever before in our lifetime. So today, I want to honor the life of another Kentuckian that we've lost to this terrible disease. This is Vicki Lynn Collins Brown of Boyd County, who was 68 when she passed away. Vicki was born in Ashland and spent her life in the city, retiring from Kentucky Farmers Bank after 26 years. Her daughter Cindy said she was loved by all her customers, and she had loved them all dearly as well. Cindy told the Ashland Beacon her smile could light up a room. She cared about everyone. She was married to the love of her life, Kenneth Brown Jr. The two had been together for 32 years. Cindy said that the family was the most important thing in Vicki's world. For the last 5 years, her favorite hobby was spending time with her grandson, Carter. Cindy said she urges everyone to listen to the restrictions and safety precautions in place and to consider stories like her mother's before breaking the guidelines. Like all families grieving, she understands the restrictions are hard. She was unable to be in person with her mom during the hospitalization, but the safety measures are important. Cindy said she'd like to thank the incredible nurses and healthcare workers at King's Daughter Medical Center on 3A and 4D that took care of her beloved mom. Cindy, thank you for this beautiful tribute to your mom. And today I'm glad that all Kentuckians can honor her. Taken far too early. It's not fair to any individual, any family when this happens. And I can't help but think that Cindy's mom is younger than my parents. And this is very real, and we need to make sure, even when we're making decisions where we can open up a little at a time, that we do it the right way so that we can prevent more families from having to go through this. All right, a couple of specific updates that we go through each time. Long-term care facilities continues to be the most challenging area where this virus is most deadly. 29 new residents, 8 new staff, and 18 deaths. Now, I know we announced 10 today. When we get them in for the first time, we have to go back and ascertain if they were in a long-term care facility. So Dr. Stack is working directly with so many facilities. A lot is being done here. More can and will be done, but this is the challenge of this virus, and this is an area we have to be careful about every single day. All right, second one is Green River. While there isn't any new update on numbers, at least that I have, I can report that when we'd seen what was happening at Green River, I instructed our folks to test every single person. It was a mandate. We needed to make sure, with everything that had happened, knowing that people in the facility were scared, knowing that people who work at the facility are probably scared. And we wanted to test every single one, and that is by far the biggest testing in any group that we have done. So the testing is underway. As of this afternoon, 250 tests have been conducted. The entire prison staff and inmates will be tested by Friday afternoon. Department of Corrections has started to update their website daily at 6 p.m. or right around it with the confirmed COVID-19 cases by institution, including the key initiatives that have been implemented. By Friday, we should have the full extent of how far this has spread in that institution, which will help us to continue to try to make the very best decisions that we can. All right, we've got about 15 minutes for questions. We have 4 of our journalists here today. We have Joe Sonka, Daniel DeRochers, Phil Pendleton, and we have Dalton Stokes, a UK journalism student interning for the State Journal. And I think given that, Dalton ought to be able to go first.
So in other states, considerable attention has been given to the R naught and RT values, and the need to get the R naught value to 1 or below, which is when one person or an infected person will only infect one additional person. Is DPH calculating these rates, and if so, what are they? And is there guidance being taken from the website created by Instagram founders that has estimated state-by-state RT values?
It's a very technical question, which is going to require a very technical answer. So we'll ask Dr. Stack both to respond to that and, if we can, to respond or talk a little bit in general about our approach at Healthy at Work and why we believe that, that it is safe and that we're making good decisions.
Thank you, Governor. So it is a technical question. It's a good question, but one thing I've tried to be, and the question is, how are we going to calculate whether we're having increase or decrease in the disease? And the reporter asked the question about values called R0 or RT. So R0 is the doubling or the transmission rate of a disease through a population. You want it to be less than 1, which means that it's decreasing. If it's over 1, it's increasing. And if it gets too high, it increases very rapidly. And so the R0 for this disease is between 2 or 3, we think, or maybe closer to 3 when it's unchecked in a close community. The steps we've taken to keep ourselves socially distanced from each other in the last 2 months have dramatically lowered that. In fact, the projections that we had going into this, when we looked at what happened in China and what happened in Italy and what happened in Western Europe and other places, suggested a really terrifying increase. We got it way down. We've done a great job. Team Kentucky came together. I think we have to be careful not to confuse science with pseudoscience at a certain level, though. There's a lot of detail and a lot of uncertainty. So, yes, we do try to calculate those numbers, but I don't have any great confidence in them because it depends on the size of the population you test, the positivity rate, where you're sampling. We have a drive-through program that's very different than the hospital program. So, yes, we do look at those things, so you can have confidence in that, but I don't have something to share. Very specifically for the governor's question, we are trying to do the best we can to balance the societal need to resume activities that are so important to society, but to keep people safe. That's what we've been trying to do for the last 2 months. It's what we are committed to doing going forward. I think we all owe a debt of great gratitude to the governor for following the science, following what we thought was the best possible science, and keeping people safe. What I just said, it's a tragedy that so many people have died. So many more would have died had we not done these things. We have done a great job. We are going to try to navigate that going forward. We ask everyone's patience. I will say some folks send me proposals directly. I'm not being rude by not replying. Please send them to the Healthy at Work website. Right on the website, there's a team who will be able to process those and look at them. That's the way I'd ask you to submit it. I don't want you to feel you're being ignored. The best way is to submit it at Healthy at Work. And Governor, did I answer all of the questions?
You did.
Thank you very much.
I used to give Kenneth a hard time. James is over there on his phone, missing the slide. Question here from Tom Latek, asking about my reaction to the University of Kentucky study released today that indicates Healthy at Home and other restrictions have cut down on the number of cases by 90%. This is what we were seeing in our data, but I want to say it indicates that Healthy at Home gets the credit. I don't get the credit. Everybody out there, every Kentuckian gets the credit for being willing to do what it takes. I don't know in any other state if people have come together in the way that we have seen, that have followed a set of restrictions, that have stayed calm in the midst of a worldwide pandemic. It's everybody out there's work that has this result. Now we got to keep it going forward. That's our challenge, making sure that as we change the restrictions a little to be healthy at work, if we can follow them just as well, we can have those good results. So let's make sure that we keep that up. Phil?
Governor, every day I probably get probably not less than a half dozen people with unemployment questions and concerns or what have you. I got one very specifically, and she specifically wanted me to say her name. She's from Lexington. Her name is Edna McCoy, and she is very concerned that she's going to miss out on her bipolar medication because she has not been able to get her unemployment taken care of. She says it costs $300, and she says that the last time she went off of it, she ended up in a psychiatric hospital for 12 days. So she wants to know what she can do to make sure she can get her unemployment to get her medication.
Do you know when she filed? I'm just trying. It helps us find her claim.
She just basically said that she waited.
Well, get that for us, and we'll make sure. It's a question about a specific individual that and not having their unemployment claim filled yet, or not having the dollars come in yet, and the fear that she won't be able to afford prescription medication that she needs, and has had some really bad outcomes if she hasn't gotten it. First, to Edna, we're going to get your claim fixed. We are down in the March claims to about 20. I think what did I say earlier? Down from 37,000 to 20 something thousand ish. This is just to 29,000, and this is March, and we need to get that number down further. But no, there are going to be some in there that are legitimate disputes between employers and an individual. But there's at least another core part of that where it is identification issues. So make sure that you have your cell phone on and you're checking your email too, and that you're checking your spam box or others, because we've had some instances where we've tried to email people and haven't gotten a response. I will tell you that the more dollars are going out, more claims are being resolved. It's taken too long. It's not an excuse. It has been a real challenge, but it's our job to live up to the challenge and to help everybody in the time that they need it. We're going to have a full update on this from Josh Benton tomorrow, but I believe tomorrow that number for March will be down further. I will say that I've instructed the March claims to be the most prioritized of all the claims, and my goal is to even have the very oldest claims that people individually called. Not you call in and you spend a long time waiting on the phone, but that you get specifically called so we can try to resolve those as quickly as possible. What's my response to the potential of President Trump signing an executive order to force the meatpacking plants to stay open? I've been following his part of that. What I will say is we got to make sure that these facilities are safe. And we can't force people to go into a facility when it's not safe. So we are working with a number of facilities across Kentucky. One of them is shutting down for a period of days, which is important to get it sanitized, to make sure that when people come back, that it is a better situation. But if you know that you've got a problem and you're unwilling to pause to fix it, you're going to have a bigger problem going forward, a loss of a workforce. It's the same as any of these regulations we're talking about, that if we don't follow them and do what it takes to lessen the spread, then you end up with a worse result. Daniel.
So quick follow-up on the date. So it said May 20th there, but it should be May 18th? Or?
No, it's a Wednesday intentionally, just like our phased reopening. The question is on the dates of what we put up today. In healthcare, we did the very first piece, and then 10 days later did the second piece. But especially for houses of worship, that comes on a Wednesday, where many of them could start that day.
So my question about the dates, though, is that, how fluid is that in that? So you're saying that they should skip the Sunday before, and then the Sunday after May 20th, they can start holding services again?
Yes.
And with the social gatherings, that's Memorial Day weekend, so people shouldn't gather on Saturday or Sunday.
We'll work through that. Everything up here is fluid depending on the coronavirus, and it's fluid depending on what we're seeing coming in. And if things are positive, we may be able to move some easy ones up a day or two. But most of these that we put up here are going to require specific rules that we ultimately I hope we can come to agreement on with everybody. But ultimately, it's our job to ensure it's safe, and that gives us some time to do them too. Because getting all these in place by May 11th, we want to get it right, and then we got to turn around and get the next piece right as well, and then do some forward planning off of that. But our goal here is to give people advance notice to where they can start doing the things they need, because the 10 rules aren't easy. Just the 10 rules before you get it, they're not easy to meet. They're important to get it right, and this hopefully gives people time. Joe.
My question relates to parents who are taking care of kids during the phase 1 reopening. If
Yeah.
an employer tells an employee you have to come back to work in May, but they have no daycare for their kids, what do you say to both
Yeah.
parents and both employees.
So the question is what happens in phase one if the employer says you got to come back to work, but you don't have daycare options, and that's the hard piece of this. My hope is that no employer will do that to somebody that would have to find that doesn't have a good option. What I'd say is it's unfortunately an issue of numbers, that we can't do any of this at all if we open a daycare right now. It's not fair, and it's hard. But if we opened a daycare right now, then we would see a spike that ultimately would set us back. Why is Kentucky behind in testing capacity compared to neighboring states like Tennessee? That goes through what it goes through what Tennessee is doing. So first, let me give you the good news. This last week, we had 14,239 tests conducted. That shows we are scaling up, and that's really important. But one of the differences between us and Tennessee is the amount of private testing from probably large healthcare companies that are there. I believe Tennessee, about 5% of their total testing is being done by the government, and that's a rough number, maybe 5.5. With us, it's over 30%. So it's falling on the government, it's falling on me and everybody in public health and everybody else to get more and more of it done here in Kentucky. We hope to see more private sector testing. It would certainly increase our capacity much faster. But even with that, the rates we're seeing are promising. We think they compare well to other states, whether that's the total number or the percentage. When you look at the total number of cases that we have, remember, as opposed to a state that had more widespread testing, we're just testing initially the sickest folks that are out there. And the fact that we have the number of cases we do, when most of the people we were testing for the first month, we were pretty sure had it or could have had it. Now, our overall number is a very positive sign that compares well with anybody. Do I have any comments on reports of research at U of L about working to block the COVID-19 infection? It's promising anytime we have any type of that news. I know it's research. I want to make sure. I mean, I hear about 8 companies working on a vaccine. I want to make sure it's going to work before I talk about it a lot, but I'm proud of U of L and any other institution out there that's stepping up and putting resources towards this and trying to help. I can answer this next one real fast. What will the recommendations for masks be while eating inside a restaurant? That's one of the things we got to work on. Restaurants is a tough piece. We want to work directly with the association and others to make sure that it's safe. Dalton, got another one?
Yes.
You gave us a really detailed one the first time.
So I had a follow-up about similar or the same question. That the website I referenced put our RT value at 0.9, which is below 1, like Professor Stack said. And do you guys agree with that? Is that accurate?
Dr. Stack, do we agree with that?
You want me to give any answer or not?
Sure.
Let me come up there. It's
Yeah.
more complicated. Here's what I'd like to answer it as clearly as I can. The question is if we think our RT number is 0.9 or if it's lower. What we have seen is that the curve, I learned I have to do this the other way. I can't use my right hand. It should have gone up. It should have gone up like this and increased. And what we've seen is our curve went up to a lower plateau, and now it seems plateaued for a period of time, and hopefully it will start going down. And so what I can say is we profoundly blunted what should have been a Mount Everest. The Philadelphia spike that the governor shows repeatedly, he said, cut the top off the muffin. We definitely did that. And so we've done a great job, and that's why we have to be very careful how we do this, because the governor's standing in front of St. Louis there. We don't want the second bump. We don't want that second bump, and we have to be very careful that we don't create that. I hate to see a new case any day. I certainly hate to see
a new death any day, and you know, it's when you're the governor of a state and that's happening to your people, it's hard. But I will tell you, there was a period of time where we were either seeing or we thought we'd see a doubling, every 3 days, and the fact that that's been blunted, I'm so grateful for everybody's work. It's remarkable, but it's also saved so many lives. We answered daycare as transparent and bluntly as I can. We do hope in June that that's a real possibility. We need to work with those facilities. I saw an article about insurance companies trying to turn them down. That's upsetting. These are really important institutions. We are going to need them again. But what I saw in that is somebody commenting on how hard, if not impossible, it is to have social distancing inside a daycare. It is. And that's one of the challenges, with youth sports and certain sports, with pools. It ends up taking all the work we've done to reduce contacts, and it expands them really quickly and really significantly. Phil?
Says the out-of-state travel ban, will that be lifted according to one of the phases? How does that exactly?
The question's about the out-of-state travel ban and when will it be lifted and how. There's always an exception for work. And so if you're going back to work in any of these phases, obviously you can travel over and back like you could if you were in an essential business. What we're going to do is we're going to make sure we can watch cases in other states. And the states around us have significant numbers of cases, with the exception of West Virginia, which isn't doing a whole lot of testing, but it has a low number of cases. Every other state around us has significantly more cases than we do. So the travel ban was put into effect for a very real and important reason, and it's been put in effect by governors all across the country. Some of them have been a little more specific, but this is something, whether you're a Democrat or Republican, if you have seen what we have seen, you've put into effect. Can I give any insight on how testing is going at Shawnee Park with regards to African Americans being tested versus Caucasians? The top zip code being tested by signups is 40211, and that has the largest percentage of African Americans in it. The top 10 zip codes with African American population in Louisville make up over a third. It's about 36%. We want to see the data on this next week as well, and we're looking for different ways that we can ultimately supplement that to ensure we're addressing a lack of testing in that area. Is it Daniel? Yeah.
Yeah, three-pronged testing question.
Okay. How you turn one question into three.
Green River, I know you're testing there. Are you testing other prisons? Do you plan on testing all nursing homes where there's either been a case or even just all nursing homes in general? And then also, in terms of testing, is there a specific goal that you're trying to hit in testing capacity before the more social aspects of the phase?
I'll answer those if I remember them in reverse order. Is there a capacity we want to hit before more social things? We do, certainly before the 24th, I believe, is when we talk about social gathering. Want to get above the 20,000 tests per week that we know that we can do. We'd like to get north of that. And we continue to get closer and closer to that. And it really, where we got to get is testing, and this is just in my mind, in three major categories. The first is targeted populations that are at risk. Nursing homes, prisons, our first responders who are at risk, healthcare workers, and there are a few others that would fall in that. So that's part one, and we got to make sure there's always sufficient capacity to do there, especially if there's an outbreak. Part two is the general public. To make this work, we got to know how many asymptomatic people there are and to be able to catch someone who may be asymptomatic and spreading it. And part three, as we're going back healthy at work, there got to be available methods where somebody who comes in to a business, has a temperature check and a spike to fever, doesn't just go home because we've got a contact trace, can go and can get a test. So those are some of the needs, and I know that there will be more needs that are out there. I want to have the structure in place for each of those. We have it for the first two, and we're working on the third. On the nursing home side, while it is a case-by-case basis based on the level of care and what actions are taken, we are doing more testing in our long-term care facilities than ever before. We are testing, in many instances, everybody in the facility. In other instances, it may be that there is one wing very separated where people are getting a lot of care, and you have a case there, and there may be a totally separate, there's some facilities in Lexington that are huge and multiple buildings, and we wouldn't necessarily test everyone everywhere in one of those large ones. It's made in direct consultation, the decision with Dr. Stack and the facility, having a plan in place, especially if a lot of the staff test positive, what are you going to do the next day, and making sure that we're there. As we move forward, more and more testing is going to occur there. And in many instances, we have tested everybody in a facility. Now, it's not always us. I said we're about 33% plus of testing in the state. So right now, I know Callaway, Murray Callaway Hospital is doing a set of full testing at an assisted living facility there. We're coordinating, but they're doing it. Joe.
We've heard from someone who's waiting on their unemployment check and their landlord has reported them to a collections agency. Is that, what would you suggest in that type of situation where a landlord can't evict them for reporting them to a debt collection agency? And also, how long is that eviction order for prohibition against that going to last?
Multi-part question. First, our prohibition against evictions is going to last at least through May, if not longer, right? Because as we slowly open back up the economy, there are still a lot of folks whose industry or area won't be open, and we want to make sure we're there for them. Now, a landlord sending somebody to a collection agency when they cannot evict them isn't the right thing to do. And I know everybody's hurting, but you don't need to hurt another person that you can't evict in that situation. How about trying to work with them about what's going to happen down the line? But the other part of the question is they hadn't received their unemployment, and we've got to get that done. We'd be happy to help that individual, but we've got to get that done for everybody in their situation. We know that it's creating hardships on people. We certainly have more people signed up in this period, probably by a factor of 10 than we've ever had, but it doesn't matter. Somebody like you're talking about can't pay their rent and is being sent to a collection agency. We will strive to do better, and we'll get a breakdown of those numbers tomorrow. So I want to thank everybody. Again, we're over at Emergency Operations Center. Thought we'd freshen it up for a couple days. We're going to be here for at least the foreseeable future, 4 or 5 days. It's a beautiful week in Kentucky, and it's hard to think that this would have been Derby week and that we're missing just one special activity in all of the special activities that we all have this week. But we are winning this battle, even though we're losing people along the way. We are winning this battle, and we're winning it because of you. Now, our challenge is going to get a little greater. It's going to be how can we go from being healthy at home to healthy at work. But given your results on how we've done it healthy at home, I know we can do this. We're going to do it together, and we're going to get through it together. And now I think we've played, as we've ended a number of times, my old Kentucky home. Since this would have been Derby week, there would have been a boat race. And the Belle of Louisville would have been the winner, and if they weren't, it would have been because the other boat cheated. And so to take us home tonight, we have my old Kentucky home played on the Belle of Louisville.